Hi, Camille here, Camille Roby, coming to you from Adult Health 1 with Professor Lukowski. So today in this segment I'm going to be demonstrating the primary IV bag procedure, and I'm going to go ahead at this point. I would have already checked my MAR, so that will be implementing standard protocol, which I would have made sure that the actual physician's orders match my MAR, and made sure that this actual procedure is for the correct patient. And if any other procedures that may have been ordered, I would have already confirmed that. All right, so at this point, I'm going to be administering my medication via the Minibag. And so I'm going to go ahead and review my information. And at this point, I have my doctor's orders, which is for vancomycin. And the order is for 2 grams, as well as, and the available amount is for 4 grams. So it would equal out to 0.5 milliliters for the vancomycin. All right, so at this point, I'm going to go ahead and sanitize my hands. Then I'm going to apply my clean gloves. All right, and so I have already prepared my actual medication, which is the vancomycin, and I have labeled it. And on here, I have put my initials. I put the date, the time, the actual medication, and the dose that was ordered from the physician. And I also have already pre-drawn up my medication, upon which I would have, which I already sanitized the actual vial with the alcohol. And then I drew up my medication, which was 0.05 or 0.5 milliliters. All right, so at this time, I'm going to have my needle already prepared. All right, so at this point now, I'm going to, now that I have already labeled my my solution, I've already labeled it, put my name, I put the date, the time, the solution, and the dose amount, which was the actual orders of it. And now I'm going to go ahead and insert my medication of my 0.5 milliliters of vancomycin, which I have already prepared and I have sanitized. All right, so now that it is inserted, I'm going to gently just mix the solution so that the medicine can be mixed together. All right, and so at this point, I'm going to go ahead and gather my tubing out of the sterile package. And it's already pre-clamped, so now I'm going to take the cap off the end and insert. And I have already pre-sanitized it. All right, so now that it is attached, I'm going to hang it up so that I can prepare to prime it. As I said before, the clamp is on, so now I'm going to squeeze the chamber twice so that it can fill up to at least halfway. All right, so now I'm going to check my tubing to make sure that it is working, and I'm going to prime it. And I'm releasing the clamp as I do that. All right, and it does work. So now I'm going to reclamp it back on. Okay. So now I'm going to hang it back up. And I already have labeled it. The tubing as well, with the date, the time, and the actual solution, and the tubing size as well. All right. So now that I have drawn up now I'm going to go ahead and draw up my 6 milliliters of normal saline solution. And I'm going to do so in a 10 milliliter syringe. So let me go ahead and gather that. Alright, so at this point, I'm going to go ahead and now that I have prepared my bag and my medicine, and I have date and labeled the time and the actual dose of the medication, as well as the tubing size as well, I'm going to go ahead and do my ASASH procedure right now, and I'm going to do so by reestablishing my line to make sure that that line is still working properly. So at this point, I'm going to do so by gathering my 10 milliliters of saline solution, a syringe, and so I'm going to, before I do that, I'm going to sanitize the end with my alcohol swab, and that's to make sure that no microbes enter at that site. Alright, so now I'm going to attach my 10 milliliter syringe. And the actual clamp is still on, so I'm going to get ready to release it now. And so with doing my ASASH, I'm going to aspirate first to check for blood return, and I see blood return. So now I'm going to inject 3 milliliters with the stop-go method, and I'm going to begin that now. So 1, 2, 3. Alright, and so now on number 3, I'm going to go ahead and reclamp it, and I have reestablished my line with that. So now it is still sterile, so I'm going to go ahead and I'm going to attach my tubing. And this is still sterile, so I'm going to go ahead and attach my tubing. So now I'm going to go ahead and begin my actual I'm going to actually, before I do that, I'm going to, at this point, assess the site to check for any infiltration. And the site still looks clear, still looks good. The skin is still consistent, no redness is present as well. So this is still a good site to use, just to make note of that. Alright, so now at this point I'm going to go ahead and start my my actual run, and it's supposed to be at the alright. So let's get this here. Alright, everything is still clamped. Okay.
Hi, my name is Mandy, and
okay, so at this point now, I have everything attached. The line is good, and there's no infiltration present on the patient's arm. The medication is prepared, everything is sterile. So now at this point I'm going to go ahead and do according to my doctor's orders, which is 8 drops per minute. So that's what I'm going to set my rate at.
Let me go ahead and start. So you go ahead and start. The first thing you want to do while you're waiting for the vein to raise, you want to connect your tubing. Okay, you want to prime this. So I think this will on this side.
Alright, so it is set. So now, at this point, this is the first time that this patient has actually received this medication. And so I'm just going to be observing it for the next 15 minutes just to make sure that everything is fine, no infiltration begins or anything like that, just to make sure that the patient is actually receiving the medication properly. Alright, and then at that point, then once the medication has ran its course, then I'll come back and check again with the patient. Alright, so now at this point I'm going to go ahead and complete my ASASH. So that's what I'm going to go ahead and do now. Okay, so at this point I've come back in to check my patient and his medicine has finished. So now I'm going to go ahead and clamp off the actual tubing, close that line off, and then I'm going to detach making sure both ends are clamped. Going to detach my tubing away from my INT extension. And then I'm going to rehang it back up using my gator clamp. And I'm going to rehang it back up like that. And so now at this point I'm going to sanitize again and just inject the last 3 milliliters of my normal saline to flush. And I'm going to do so in the stop-go method. 1, 2, 3. Alright. Just clamp it on. Alright. So now at this point I would go ahead and administer heparin if the doctor has ordered it. But in this case he has not, so I'm going to go ahead and just throw away all of my sharps into the sharps container. Alright, and then at this point I'm going to enter my documentation stage. I would have documented the date and the time of when I actually administered the vancomycin to my patient. I would have once again checked my MAR. I would have also documented the route, the actual condition of the site to make sure there's no infiltration. I would have also put the actual volume that I would use to actually deliver the medication. And of course I would put my initials as well and any further instructions that I may have given to the patient. Alright, and so that concludes my completion protocol.